And good afternoon again, Cheryl. The statistics show COVID-19 is disproportionately affecting African Americans. And this is not only true in Ohio, but across the country. And News Center 7's John Bedell spent part of his day looking at the concerns folks have in the African American community and why a doctor says this might be happening.
Hope everybody, stay safe, take this stuff seriously. This ain't nothing to play with.
Talmadge Harold told me he works in a nursing home. I asked him how worried he is about getting COVID-19 because of how data is showing the virus is disproportionately affecting minorities just like him.
I'm concerned, wish my life every day going to work. I work in a nursing home, make sure the elders ain't trying to get it.
A new survey from the Pew Research Center shows there is greater concern over the virus in the black community. 31% of African American adults said they are, quote, very concerned about getting COVID and ending up in the hospital because of it. Just 18% of white adults said they're very concerned about that happening. And there's data to back up that worry. Nationwide, the CDC says a third of the people hospitalized for COVID have been black, even though African Americans make up 13% of the U.S. population. Here in Ohio, Governor Mike DeWine says 21% of the state's cases are in African Americans, while only 13 to 14% of Ohioans are black.
It's because I'm taking care of the entire family and people across all socioeconomic statuses. And so I do see that contrast as far as healthcare outcomes and such.
Dr. Gary Leroy works with a lot of minority and low-income patients on Dayton's east side. Dr. Leroy said it's taken a global pandemic with a virus that doesn't discriminate to make more people realize what they've known in the medical community for years, that minorities are more likely to have poor health outcomes.
And this is because of a myriad of reasons. These are individuals that, to no fault of their own, exist on the soft underbelly of our society's economic system. They're more vulnerable for poor health care outcomes because of unemployment, educational opportunities, diabetes, hypertension, and chronic diseases and such.
Dr. Leroy said he's interested in what Governor DeWine's new task force on the issue DeWine calls very, very concerning recommends. Dr. Leroy says the goal here should be
emerging from this crisis smarter than we were when we went into this crisis about who they need to provide these critical resources to and how we can prevent this from happening, this disproportionate death rate from happening in these vulnerable populations.
Governor DeWine is calling this new task force the Minority Health Strike Group. We'll let you know what they come up with. In Dayton, I'm John Bedell, News Center 7.